Good afternoon, ladies and gentlemen. Today I'll be talking to you about the side effects of in vitro fertilization. This presentation aims to educate you about the potential dangers of the procedure, as you might be asked about by any of your patients. Have any of you recently spoken to your patients about IVF? Well, around 1 in 7 couples in the UK have troubles conceiving. That's around 3.5 million people in the UK alone. A lot of people resort to IVF as a treatment, with the latest data showing increasing rates of IVF babies per year, standing at 25,500 in 2015 in the UK alone. IVF has been proven to be safe over time, however there may be complications. The NHS has identified the following as potential complications of IVF treatment: medication side effects, ovarian hyperstimulation syndrome, ectopic pregnancy, birth defects, and multiple births. First, the medication side effects. The drugs administered during an IVF treatment play a role in controlled ovarian hyperstimulation. There are 3 medications typically administered during an IVF cycle. It's clomiphene citrate, gonadotropins, and human chorionic gonadotropin. Clomiphene citrate. You might have heard of this one before, as it is used to treat polycystic ovary syndrome. Also known as Clomid or Serophene, it is given to women who do not ovulate normally. Administered orally once a day, it is a non-steroidal selective estrogen receptor modulator. It inhibits estrogen receptors in the hypothalamus, upregulating the HPA axis and releasing gonadotropin-releasing hormone by the hypothalamus, and thus releasing increased levels of pituitary gonadotropin. Its side effects include hot flashes, blurred vision, nausea, bloating, headache, and changes in the cervical mucus. Next are gonadotropins. As you probably know, these injectional hormonal medications are found under different brand names. For example, Gonal-F, Folistim, Menopur, and Nuvaris. They are usually a mixture of gonadotropin-releasing hormone, follicle-stimulating hormone, follicle luteinizing hormone, and human menopausal gonadotropin, just in various proportions. Their side effects include headache, nausea, stomach and abdominal pain, pelvic pain, bloating, breast swelling, acne, or skin rash. The injection site may swell or bruise, as well as get infected. Finally, we have human chorionic gonadotropin, known by Novorol, Ovidrel, and Pregno. The most commonly reported side effects included rash, groin pain, loin pain, and fever. Tenderness, swelling, or bruising at the injection site can be observed. It can also cause ovarian hyperstimulation syndrome, which is a common side effect of IVF. Ovarian hyperstimulation syndrome can occur when the ovaries are overstimulated by fertility medications and hormones. It mostly demonstrates by painful and swollen ovaries. Its occurrence is dependent on the administration of HCG, and around 3 to 5% of women will develop it. The symptoms usually develop 3 to 5 days after the HCG injection, sometimes being delayed up to 7 days after. Among others, the risk factors are polycystic ovaries, younger age below 35 years old, OHSS history, high luteinizing hormone to follicle stimulating hormone ratio, and high serum estradiol. So ectopic pregnancy is another common side effect. As I'm sure you know, it is a case of abnormal pregnancy during which the embryo implants itself outside of the intrauterine cavity. Approximately 1 to 2% of all natural pregnancies are ectopic, compared to 2.1 to 8.6% following assisted reproductive technology treatment. It is the biggest cause of maternal mortality, 5 to 10% depending on the country, as the tubal rupture causes major hemorrhages. And it is unknown whether the increased rates of ectopic pregnancy after assisted reproductive technology are due to the treatment itself or pre-existing fertility conditions. As seen on the graph, the vast majority of ectopic pregnancies are either ampullary, uh, isthmic, or interstitial, together being called tubal pregnancies. Uh, Ampullary ectopic pregnancies take the lead through take Ampullary ectopic pregnancies take the lead though in 80% of all cases. The remainder of ectopic pregnancies are located in the ovaries, cervix, and the abdomen. The identified maternal risk factors increasing the likelihood of ectopic pregnancy are tubal infertility, pelvic inflammatory disease, history of tubal surgery, previous ectopic pregnancy, cigarette smoking, and endometriosis. As said before, IVF increased the likelihood of ectopic pregnancies, and a high volume of transfer media and multiple embryo transfer have been identified as risk factors. So birth defects are more common following IVF too. No matter the technique of fertilization, birth defects will be present in a portion of the births. As you can see, the most common ones are Down syndrome, cleft lip, and atrioventricular septal defect. You must have Birth defects are more common following IVF. No matter the technique of fertilization, birth defects will be present in a portion of the births. As you can see, the most common ones are Down syndrome, cleft lip, and the atrioventricular septal defect. You must have come across most of these. It is worth noting that a recent analysis of 300,000 births has suggested that women aged 40 or over who give birth thanks to IVF are actually less likely to birth children with major defects than those who conceive them on their own. The percentage decreases from 8 to 4%. The number of birth defects, however, goes up in the population of women aged 29 or under, from 6 to 9%. It is also worth noting that the maternal risk factors for birth defects established for the fertile population yield different results after assisted reproductive technology procedures. As the risk factors differ in between different ART treatments, if you discuss different infertility treatment options with your patients, make sure to discuss their respective risk factors. Finally, there's a much higher risk of multiple births in women treated with IVF. Finally, there's a much higher risk of multiple births in women treated with IVF. Finally, there's a much higher risk of multiple births in women treated with IVF, as usually more than one embryo is transferred. The multiple birth rates of women treated with IVF are almost tenfold of those that were not treated. These are the recommended limits on the number of embryos to transfer, so it should give you a rough idea. And favorable means that the patient is either undergoing first cycle of IVF, has good embryo quality, has excess embryos available for cryopreservation, or had a previous successful IVF cycle. These are the recommended limits on the number of embryos to transfer. It should give you a rough idea. Favorable means these are the recommended limits on the numbers of embryos to transfer. It should give you a rough idea. Favorable means that the patient is either undergoing first cycle of IVF, has good embryo quality, has excess embryos available for cryopreservation, or had a previous successful IVF cycle. Having more than one baby at a time increases significantly the risk of complications for both the mother and her kids. The problems most commonly associated with multiple births include miscarriage, miscarriage of both fetuses or only one, pregnancy-related high blood pressure and preeclampsia, gestational diabetes, anemia and heavy bleeding, needing a cesarean section, premature birth. There's over 60% of twins, and nearly all higher order or multiple are born prematurely. The babies are also more likely to be born with a low birth weight and are at an increased risk of developing life-threatening complications such as neonatal respiratory distress, the babies are also more likely to be born with a low birth weight and are at an increased risk of developing life-threatening complications such as neonatal respiratory distress syndrome or long-term disabilities such as cerebral palsy. Well, thank you for listening. As there is a growing interest, well, thank you all for listening. As there is a growing interest in IVF as a solution to either male or female infertility, it is extremely important that you are aware of the potential risks and dangers of the procedure, however small they may be. Your patients will often turn to you as a first source of information. I am willing to share with you the transcript of the presentation along with the sources if you would like to read up more about it. Remember to reassure your patients that the side effects are absolutely normal and they will be monitored throughout the entire process of IVF treatment. Before we finish, does anybody have any questions? Well, thank you once again for listening. I hope you have a nice day.